Your glutes, the muscles in your butt, they play a huge role in stabilizing your lower back. But one problem is that most people sit way too much, probably even you. And when you sit for long periods, your glutes can actually turn off. They stop activating properly during movements like squatting, bending, or even just walking. And when that happens, your low back and hamstrings have to pick up the slack. So that's when you start to feel low back pain, get tight hamstrings, hip discomfort, and even bad balance, all because your glutes aren't doing their job. But the good news is you can fix this. You can retrain your body to activate your glutes so they start stabilizing your low back again. One of the best exercises for that is called the glute bridge, and we're going to go over that today. But before then, I want to show you something. I want to get the activation process started by doing this. So simply just while you're sitting or standing, while you're watching this, I want you to contract your glutes. I want you to squeeze your glutes together. It's like you're pinching them together. There's something between the cheeks, and you're just squeezing and holding it there. And so do them both at the same time, and then see if you can actually do one side, relax, and then the other side. See if you can coordinate that, have the coordination to do that. So this is something that you can do even throughout your day while you're sitting there. If you're on your phone, if you are, at your computer, you can just practice that to activate it. So the muscles, so the glutes actually get the stimulus, get the activation throughout the day. But now I want to show you what the actual glute bridge is so you can incorporate this in and get even better and more activation, which means more strength and more stabilization for your low back. So what you're going to do is you're going to lay down on your back or lie down on your back, knees bent, feet flat on the floor, just like you see me doing right here. Before you even do the exercise, I want you to do two things. One, I want you to perform an abdominal brace. I want you to tense up your core muscles, your ab muscles. And I'll link to a video that shows you how to do this. But essentially, it's like you're pulling your belly button towards your spine. Another way to think about it is if somebody's about to, punch you in the stomach, and your gut muscles tense up, that's the maneuver, that's the abdominal brace exercise. And this helps to just stabilize the core. It's like a back brace. All right. We have our own built-in back brace. But again, these get weak, especially with low back pain, and get uncoordinated. So that's number one. We want to do the abdominal brace. You're going to hold your stomach tight, but still breathing. Again, watch the video that I'll link in the description. Then the next thing is you practice this already by squeezing the glutes. I want you to, even before we start the exercise, I want you to squeeze the glutes together. Now from there, you're actually going to lift the hips up. So you lift the hips up off of the floor. You want to create a straight line if you can from your shoulders to your hips to your knees, but you don't want to overextend. You don't want to take it up too far, because this is a glute exercise. It's not a low back exercise. We're activating the glutes. So you're holding the stomach tight still. You're contracting and squeezing the glutes, okay, to lift your body up. Now, you can have your hands out to the side like this, and that will help with your stability to start. Now, you can, as you get stronger, as you get more stable, as the glutes start to activate, you can make it a little bit more challenging by putting your hands on your stomach, putting your arms closer to your body, so it decreases the base of support. So then your body and your muscles, your glutes have to work harder. Your nervous system has to work harder. And you're, again, building more strength, more balance, more activation in these muscles. So that is the ideal position right there. Now, to give you some help, because like I said, if you sit too much, or if you've had low back pain or other injuries, joint pain, hip pain, these muscles, the glutes can shut off, and we need to make sure we're not working the hamstrings and the low back in replace of the glutes. This is a glute exercise. So to do that, so again, you see here, one thing to think about is, okay, I'm going to take a dollar bill. I'm going to hold it between my butt cheeks. And you're holding it there. That's an image you can have, or a key that you can have as far as, all right, to make sure that this is a glute exercise, not the hamstrings, not the low back. So another one is number 2. You could actively, it's isometrically, but actively, so your feet aren't going to be moving, but you're going to try to slide your feet forward, not push back, because that can activate the hamstrings more. By pushing the feet out just a little bit while you're in this position, again, pushing against the floor, trying to push the feet out, but they're not moving, it deactivates the hamstrings and allows, again, more of it, the glutes, to be the recipient of the activation instead of the hamstrings. So that's what we're trying to do. Another one, to activate more of the glute, not, even the outside of the glutes, glute medius more, you can put a band around the knees. So your feet are, about hip width apart. And as you are doing the bridge, you're coming up and then bringing the knees apart slightly. And with the bridge, and I didn't mention this, but I'm sorry about that, but you're going to hold this position, whether you're using one of these methods here, one of these, including the next one, you're going to hold that for about 5 to 10 seconds, and then you relax it down. And then start that process over again. Abs tight, squeezing the glutes, lift up, hold 5 to 10 seconds. You can start at, as little as a couple of reps, but working up to sets of 8 to 10 reps, holding each of those reps for 5 to 10 seconds. Doing, again, starting, you can do them throughout the day. You can do them as part of your workout. You can do them as part of your warm up, part of a break in the day where if you are sitting too much, where you're doing a set of 10. Or again, you could start doing 3 sets of 10 and working up to maybe even 6 sets throughout the day. So that's a tip there. And then another one is, if you have a ball of some sort, even a pillow that I've used, instead of the band around the outside of your knees and outside of your thighs, now you have a ball that you're squeezing. So it's activating different muscles. It's more of the inner thigh muscles, and making sure that, okay, we're keeping everything nice and tight, nice and stable. One thing to do to even make it harder without using any of these, external objects, you can bring the feet closer together. Just like I mentioned, bringing the hands up on your belly or closer to your body instead of out away from your body. By decreasing that base of support, well, now again, your nervous system, the nerves, the muscles, they're going to have to activate more, to have to stabilize you more. But these are all progressions that you can do. And if you want, I created this ideal exercise prescription for a healthy 100 years to take the stress off your body, make sure the muscles, the joints are doing the work, the job, and we are conditioning them to do the work that they're supposed to do. So this is a exercise guide that I put together that organize, sample exercise routines. You can create your own. I have videos and instructions on how to do all these exercises to make sure that you're healthy, that your body, your brain, your spine is healthy for 100 years. So if you want that guide, just type in MOVE, MOVE, in the comments, and I'll make sure I get that to you. And in the meantime, I want to make sure that you are being your own guarantee for your health and your life. All right, talk soon.